those affected by mitochondrial disorders, UMDF is here for you. Since 1996, we've worked to provide support, fund research, and create awareness.
Our mission is to promote research for cures and treatments of these diseases and to give support to affected families.
We want future generations to grow up in a world without mitochondrial disease.
I'm playing for the United Mitochondrial Disease Foundation.
Look at that. Nice check for you.
Over the years, our community has grown and our message has sparked a movement.
Hey everybody, it's Maya Mialik. Have you ever heard of mitochondrial disease?
Together, we've been able to make a difference for patient families around the world. Today, we are helping thousands of people navigate their mitochondrial disease journey. We're here, listening and providing support. We're here, educating and connecting patients and healthcare providers. We're here, finding and funding the best cutting-edge research. We will not rest until we find a cure. Join the movement at umdf.org.
Hello, everyone, and welcome to another edition of Ask the Mito Doc, sending kids back to school this fall. And it takes on a huge significance when you are a parent with a medically compromised child. A lot of questions, a lot of concerns, and we hope to be able to get you some really good answers and advice from both the medical side and the emotional side of this important issue facing our community. And joining us tonight for Back to School is from Children's Hospital in Philadelphia, Dr. Amy Goldstein, Dr. Beth Heuer, and Sarah Stoney, who is a licensed social worker. Now, here's how we're going to do this today. All attendees are automatically muted for the call, and during the webcast, please use the Q&A to submit your questions to the hosts and panelists of the meeting. Hosts and panelists will present questions to the speaker for a response at the end. Also, we want to remind you that we are concentrating our questions on the topic at hand, which is back to school. And if time permits, we will try to get to other questions that you may have. We'd also like to thank our sponsors for the evening. We have a lot of support in allowing us to be able to do these various webcasts and bring you the very latest information to you directly and bring you the very best in medical professionals and scientific professionals. So we'd like to thank everyone for sponsoring us. To view the videos from UMDF Power Surge, you can visit our Power Surge website. And we'd also like to remind you that all of our webcasts are available on our YouTube channel. So please go check that out. And we've got a lot of great information there as well. And really important, if you haven't done so already, we would really like you to be able to sign up for an Energy for Life walkathon near you. You can do that at energyforlifewalk.org. And save the dates because next year, 2021, if all is well, we will be in Charlotte, North Carolina from June 23rd through June 26th for mitochondrial medicine. It is our 25th anniversary, so we look forward to seeing you there. So thank you for joining us tonight. We will be very delighted to take your questions after the presentations that our distinguished panelists are going to make. And I'd like to thank the three of you for joining us tonight and taking time from your busy schedules to be able to handle this very important topic, because there are so many concerns and so many fears, and we really don't know still a lot about COVID. So with that, I'm going to turn everything over to you, Dr. Goldstein, so you can better explain what parents can do and how we can help this situation get better for them.
All right, thank you so much, Cliff. I would like to thank the UMDF for giving us this opportunity. I'd like to thank my co-presenters, Beth and Sarah, and you'll hear from both of them shortly. I thought what we would do first, however, is really start to tackle the back to school question. And I want to preface what I say by this, that I think that we've all been very surprised about COVID-19, and I'm not going to tell you tonight to definitely send your child to school or definitely have them stay home. We're going to have to weigh a lot of different factors in your decision making about back to school. And likewise, if you are a parent or an adult struggling with the decision to go back to work, we're going to also have to make some very individual decisions. We've been getting phone calls for weeks, if not months, about back to school. And in preparation for answering this question, I've gone to many sources. Of course, we've been tuning into the CDC and the World Health Organization from the beginning, but I've reached out to experts in this field, such as Peter McGuire at the NIH. And just recently, I went back to the Mitochondrial Medicine Society board and said we need a position statement. And that statement has been drafted, finalized, and circulated to the UMDF. And you should start seeing that everywhere. But we drafted this specifically with the aims of helping everybody make a decision. So with that, Beth, if you could please advance to the next slide. And I'm going to read some of this, but I don't want to read it word for word. But basically, again, to go back to the very beginning, March 13th, Friday, was my last day in clinic for months. And I had no idea that Friday that when I was being told I was going to go home and I might not be able to come in, I thought this was going to last a week or two, maybe, who knew? And then we very quickly put together telemedicine, which has been a wonderful endeavor and it has allowed us to stay very active in our patients' care. And we continue to do that, but I've since now been back in clinic for the past 3 weeks or so, and I'm doing a hybrid model where some days I go into the hospital and some days I see patients right from my house on Zoom calls or something similar. And so I think we've all been a little bit blown away by how long this is lasting. And again, as Cliff had said earlier, all of the unknowns. So to say this is unprecedented is true. I mean, certainly in my lifetime, I wasn't around for the last big pandemic. And of course, there are so many other things that are in play now than the last time the US experienced a pandemic of this caliber. But there are many questions that come up from patients, from families, and we're between a rock and a hard place. There are issues with going back to school and there are issues with staying home. And so as we see things reopen in places like Georgia and in places like other countries that have had school back in session, we're learning as much as we can, as fast as we can, so we can guide our families. We don't know a lot. We don't know if patients with mitochondrial disease are at more risk for contracting COVID-19. And we also don't know if somebody gets COVID-19, if they will have severe manifestations of this disease. And as I said, I've spoken to infectious disease experts. I've spoken to Peter McGuire from the NIH, who is collecting a registry for patients with mitochondrial disease. And we've also really kept our finger on the pulse of what's happening in child neurology. Sarah Stoney is a social worker who takes care of many fragile children with similar issues like leukodystrophies and muscular dystrophies. And these patients and families are facing the same exact questions. Is my child, or am I too fragile to return to normal life? Am I going to get COVID and will I have horrible manifestations? And so we are collecting registries, but at this point in time, today, as of today, we have no indications that someone with mito is more likely to get COVID, and if so, if they're more likely to have significant complications or even mortality. Having said that, when I really talked with Peter one-on-one about what should we be telling our patients and families, I'll go through some of these recommendations about all of the things that you should be weighing and measuring when you're thinking about returning to school or returning to the workplace. I just also want to point out that some of our patients are pediatric patients, and here at CHOP, there's been a lot of activity in COVID with a very severe inflammatory syndrome that is called MISC, and it is similar to Kawasaki's disease, and this is being seen in children. So far, we have not had any children with metabolic or mitochondrial disease have that particular situation, and we don't know if children with mitochondrial disease are more at risk for having the MISC inflammatory syndrome from COVID. Beth, if you could advance to the next slide, please. Now, we know that our patients sometimes have immune issues. Patients with mito could have an immune deficiency, although it's not very common. We also know that when our patients get sick, not necessarily because they have an immune issue, but just because they catch whatever's going around, This is when we worry about our patients. This is why some of our patients have an emergency room letter, or we say, please, if you have a viral infection or a fever and you can't control it easily at home, go to the emergency room. We worry about metabolic decompensation. Just like all the other unknowns, we don't know if COVID would provoke a metabolic decompensation. And what we believe at this time is that if the person with Mito has metabolic decompensations due to regular viral infections or bacterial infections, they may have a similar reaction when they get COVID-19. And the same precautions that you take for any other infectious illness should be taken with a COVID-19 either exposure or if you know someone has it. Again, we don't have any evidence that people with Mito may have increased risk of complications. Okay, and now we can go to the next slide, please. So, as I said, we've gotten together in the last week or two to draft a Mitochondrial Medicine Society, and the Mitochondrial Care Network board also got together, and we worked on this together. We advise our patients to follow the CDC's recommendations to help reduce your risk of exposure, and of course this includes wearing a mask outside of your home, wearing a mask if you're indoors, and this is if the child is old enough and not at risk for not being able to tolerate the mask. That really does affect very few people. We understand that there are some children that cannot tolerate the mask, and they probably should not be going out unless it's absolutely necessary if they can't maintain that mask for their own safety. We also advocate social distancing, hand washing with soap and water or antibacterial solutions, avoid touching the face, and choosing your interactions with other people very carefully, trying to limit how many people you expose yourself to or your family to. And a lot of people have buddied up with other families and friends and formed these quarantines so that you know that that other family is also being very, very careful, and that way you can visit each other's homes, but you have to make sure that you know exactly how many people that other family is being exposed to. If somebody needs to come into your home, either home care nurse or physical therapist making a home visit, or even just babysitters or tutors, you need to choose those child care providers carefully. They should be removing their shoes when they come into the home. They should be washing their hands and wearing a mask inside the home. And certainly the home should be ventilated so that you are not in a poorly ventilated room. And to try to maintain social distancing when they're not providing one-on-one care. With respect to children returning to school, again, and there was, I think, some articles today. Every day I get exposed to so much COVID news, I can't keep it all straight. There was an article today, either in the Washington Post or the New York Times, about younger children in the elementary school level, that they are really not spreading it to each other per se. If a child in elementary school gets COVID, their usual exposure is an adult in their own household or a teacher. The children we know harbor coronavirus, and it's been found when they've gotten swabs in their nose or in their nasopharynx, but they're not really spreading it to each other. Now, every time I read something about COVID, I feel like another report comes out the next week, whether we're talking about medications or risks of infection. So what I read today could change tomorrow. And I think that's one of the hardest things that we've had to deal with in the last couple of months, is this ever-changing, growing bulk of information, and sometimes it's contradictory. They did say that high school students are in fact spreading it to each other, and certainly older than high school students. So if you have a child in college, or if you are a college student or a young adult, that certainly this tends to be a very contagious group of people. The unknown are the middle school kids. You know, are they going to be more like the elementary school children or more like the high school students? And that we don't know. So returning to school is certainly not a coronavirus-free environment, and we've seen that now. Again, I'm pointing out Georgia because those are the reports that I'm familiar with. Georgia went back to school, and already some of the schools have 900 people on quarantine because some down with coronavirus, and then they decided to shut down school for 2 weeks. And this is going to be, again, a growing situation as schools return to whatever they're going to do this fall. So the bottom line is this: everyone is living in a different area of the country with potentially different exposure rates and different rates of incidence at this current time. We were a hotspot here in Philadelphia a few months ago, and then it kind of died down. And then all of the action was in Florida and Texas. California has had its peaks and valleys. The Northwest has had its peaks and valleys. So it's going around the country, and we're not even over the first hump. And there are people that are concerned that things are going to get even worse when we hit that second hump, which is right now expected to be in the fall. Again, realizing that anything could change with the growing news. So we can't make a global decision for everybody in the U.S. And so this has to be an individual decision. And we came up with a list of things that we want everyone to be thinking about. And that includes not only the child who is school-aged, or if you're an adult, whether you should return to work, and whether other people, the asymptomatic siblings or the parents that need to return to work, whether everyone can go back to their normal activities. If you could go to the next slide, please, Beth. So issues to consider, again, include how affected is the person with mitochondrial disease. We are concerned that children and adults that are wheelchair bound, have very low muscle tone, have weakness, need ventilators or some type of respiratory support at night, might have more complications if they contract COVID-19. Another question is whether the CDC guidelines are in fact being implemented and followed either at school or in the workplace or any other activity, meaning the masks, the hand washing, and the distancing. Another thing to consider, and this might be in the favor of returning to school, is that affected person missing out on therapies they might typically receive while at school? And are there any other options? And Beth and Sarah are actually going to go through some of those options. And one of our questions that we've asked our patients every day in virtual clinic is, what have you noticed since you've been at home? Is school harder? Is school easier? Are you able to rest more? What are the benefits and what are the disadvantages of being out of school? Have there been any regressions since being out of school, either due to lack of therapies, education, or socialization? And the AAP, the American Academy of Pediatrics, came out with a statement about a month or so ago saying that the pediatricians of America really felt that children should try to return to school as soon as possible because children are missing out on socialization and education. And this could be a really big issue post-COVID. And other pediatricians actually denounced the statement and said it's more important to keep alive at this point if this is going to turn into be a life or death situation for that child, and we can worry about catching up and socialization later. However, if that child stays at home and is not getting education, is not getting therapy, then there are going to be some ramifications for that. Similarly, we know that there are families that have no other option. They don't have childcare, and parents have to return to work, and school has been the childcare for that family. If there are other questions about specifics, we recommend reaching out to your PCP or pediatrician, of course your mito doctors, any other physicians if your child has specific cardiac or neurologic or pulmonary concerns. And again, realize that your medical team may not have all the answers right now. We are also anxiously following CDC and WHO guidelines on a daily basis, and it does change daily. Beth, that might be my last slide, so you can go ahead and advance. And again, if that is my last slide. Oh, okay. Yes, thank you. So as I've been saying, the situation has been changing rapidly based on community spread, based on local recommendations. Some of you think you're going to make a choice or have a choice, and then you might find out next week or even tomorrow your school board has decided school's all virtual for the fall. So sometimes the decision you need to make is taken out of your hands. Some of the schools are saying to the families, you choose. You choose. We're going to let you either do virtual or at home or some hybrid model, and so it's up to you. We realize you're all being put in very difficult situations because there is no perfect answer. Of course, you want to protect your loved one who has mitochondrial disease and offer them a safe environment, but also offer them an environment where they're going to thrive and get therapies and socialization and education or be able to return to work safely. So there are many websites to go to, and if needed, Kara or Cliff can help me put these into the chat so you have them. The UMDF has a specific page about coronavirus. The CDC website is there. and there are several websites for this. I also want to mention Mito Action also has their own coronavirus webpage. I learned that today. And they also have good resources, and these are all very nice complementary resources. So please, I'm sure you've already been on these sites and or getting your information from various channels. Please try to get your information about coronavirus from scientific sites as much as you can, because again, there's a lot of misinformation out there and things are rapidly changing. So I think that was my last slide, and I'm going to turn the talk over now to Beth, so we can talk more in depth about school-related services. And again, we will hopefully have time for your questions at the end. Thank you very much for your attention. Go ahead, Beth.
So hi everyone. What I want to do, with all of our experiences and what we need from our schools and where our child is entering or continuing is going to be very different among the group that I'm speaking with today. But I did want to start off with a couple basic definitions. Some of this will be a review for people. Some of you may be launching into this for the first time during a pandemic, but I wanted to make sure that I briefly mentioned what an IEP, or an individualized education plan, is. And this is a written legal document. It details your child's strengths, their weaknesses academically. It has to say what they're going to do to help your child in what areas and how. They have to set measurable goals. Then the IEP will state who's going to do what for your child, by when, what the goal would look like, and why also that they're doing it. And I also wanted to make a mention in terms of definitions of just what psychoeducational testing is. And this is education that's done through the school district. So I'm going to talk a little bit about how to get some testing or how to get retested or some of the implications of that. But I wanted to make sure that I made note of that for you. If you're looking at how do you get in-school services for your child may need educational services. They may also need their physical therapy, their occupational therapy, speech therapy, vision and hearing services, whatever that might be. And one of the things that families have to do if their child is new and not getting services, or you're starting to think, I'm a little bit worried, they're lagging. So what you need to do is request an educational evaluation in writing. It's pretty much a simple note of, this is the problem my child is having. I would like to request educational testing for my child. Always a nice disclaimer is, I understand that the school district has up to 60 days to complete the testing, develop the report, and meet with me to discuss these results. That's the law, and it's really helpful if they know that you know that. Now, after you send the letter to the school, I like to take them directly to the school office and have someone sign it and date it and make me a copy so that I have proof that it's been asked for. The school basically has 10 days to determine whether this is necessary. And if they don't feel that this is necessary, they have to explain to you in writing why. And the law then states that you can file a grievance. So once the testing is underway and you've gotten the results, they will meet with you to talk about it, what the individualized education plan is, present that document saying who's going to do what, when, and why, and then your services begin. It sounds so simple. I wish it was as simple as it sounds. IEPs come from the IDEA, which is the Individuals with Disabilities Education Act, and this was formalized in 1998. This is federal legislation that states that they have to design special instruction to meet children's unique needs. Some of the provisions for this include that they have to screen and identify the children who need this. And if you are identifying that you want testing, that the law comes in right then and there. The evaluation cannot in any way be discriminatory. The next things that you see here, FAPE means free access to public education, which all children have. And then LRE means in the least restrictive environment. There are safeguards that have to be in place to let parents know due process, mediation, appeals, etc. And then what due process is guaranteeing impartial hearings if there's a disagreement between what you feel that your child needs and what the school is telling you that they're going to give your child. So now in a pandemic, how does federal law, how is it impacted? And the truth is, this is law. The requirements cannot be waived just because there's a pandemic, and it's so important that the school knows that you know that. The districts have to ensure that children with special education needs have access either to the same learning platform or an equitable learning platform as their peers. And in truth, some instructional accommodations can be met in that online environment, and it might be individualized phone work or video conferencing, but they can't waive or say, well, it's a pandemic, we don't have to do IEPs right now. The American Academy of Pediatrics, as Dr. Goldstein already mentioned, has also looked at the special kids with special education needs, and is very clear that kids that have those needs may be more negatively impacted by distance learning, and they can be disproportionately impacted by interruptions in their regular education. And so it might not always be feasible, depending on the individual needs of the child and the adolescent, to adhere both to the distancing guidelines that we're putting out and the criteria in the child's IEP. So they may attempt to handle those physical distancing guidelines very creatively and often on a case-by-case basis. The next piece that we'll talk about is the idea of compensatory education. And this is that your child may have lost instructional time, they may have loss of skills or regression as a result of extended school closures and disruptions to their in-person instruction. This is all stuff that we may expect during a pandemic, but the compensatory education is what you as a parent have a right to make sure that your child is getting. They might have, their rate of progress on their IEP goals might be different. There might be a difference in how the school is monitoring your child's progress that is also written into that IEP. There may be a difference in services between what the school says they're going to do and what is happening because of school closures, as well as the accessibility of those services offered. What's really needed is input from the family as to what your child is needing. You need to set up a schedule of regular check-ins with your school's teacher or your special education office, and that may include the therapists who work with your child, speech, PT, OT. You may really, if your child is at home getting their education and you're struggling a little bit, you might want to ask what the teacher did to make learning easier. Well, I know that you know your children better than anybody else. The teachers may have some tips that could be helpful for you. You may just want to ask for feedback on how the child is doing from the teacher's viewpoint now that they're learning at home. So it's going to be super important that you're in regular contact with the school. Now, I drafted this, and I really am hoping that we can make this accessible to you. This is a nice email message that I came. You can contact your child's teacher or a member of the special education team if they haven't contacted you yet about your child's special education services. This is totally changeable, but it's pretty much that very friendly, hey, I hope everything's going well. I realize you're busy planning. As you know, my child has an IEP. and I'm concerned that my child will lose skills without special education services. So I'm writing to request that you develop and send me a remote learning plan so that my child can receive special education services during the closure. It's important for me, the parent, to understand the instruction and services and how the district's going to remotely address my child's needs. I also need to understand how materials will be adapted, what supports are going to be provided so that my child can learn remotely. A schedule for working directly with teachers and service providers is also very important. Thank you in advance. Thank you for all you do for my child. We butter them up a little bit, but this would be a great thing for you to start out with at the beginning of this school year to set the framework, letting families know you're a little bit of a squeaky wheel, and I love squeaky wheels because you know your child better than anyone, and you don't want to see your child regress during this pandemic and during all the changes that they're undergoing. So there may also be some barriers. Our kids that have attention issues or communication difficulty may have trouble sitting in front of that computer for significant periods of time. I know sometimes 504 plans for children with ADHD, and I'm going to talk about 504s in a second if you're not familiar with that term, might include regular breaks, a couple minutes of instruction followed by a few minutes of movement. So those may be things that you need to do at home. And then the OT, PT, and speech therapists often touch students to guide them, and there really aren't good substitutes for that over video chat. So that's another barrier that we're looking at. So a couple of the things that are going to be really important is for you to keep a really good documentation of your child's at-home learning. You want to make a list of what the school's already provided and the format they're putting it in. You can write the dates of each lesson and how your child reacted. If they're having any regression, making a note of it, basically keeping a school diary. As you've been home all these months with your children, I think that you understand the importance of keeping structure to their days, and it's going to be very important, and I can't say it enough. Go easy on yourself right now, because teaching your children at home is an incredibly stressful thing, very, very stressful, and then really trying to make sure that you're advocating for your child so well is also a very stressful thing. Sarah is going to talk a little bit about social and emotional aspects in a few moments, but we all know that transition in and out of school can be really hard for kids that are differently abled, and that may mean that the hybrid plans for schools could be extremely hard for them as well, and that may factor into your decision making. So if any of you are first timers who are sending your children into preschool and kind of wondering about that process and are worried that it got swept a little bit under the rug with the pandemic, if your child has received early intervention or birth to 3 services, they have developed an IFSP for your child, which is an individualized family service plan. And this carries over, it's like a mini IEP. This is going to carry over until the testing can be done for your child to have an IEP. But preschool kids are under an IFSP, and it does specify what services will be provided in detail. Now, if your child's heading into public school or into the school setting, the IFSP will carry over until testing can be done for that individualized education plan. They want to make sure that the services that the child was receiving in preschool are still appropriate. Some of you may have had your child taken in for kindergarten readiness testing, and that's a really important thing to talk with them about your child's readiness for school. And then this is going to be your first time in navigating the world of IEPs and 504 plans. Then there's the big transition if your child's going to middle school for the first time, starting to change classes, going to the high school, going to the new school. And it's really important that IEP goals are carried over, but this is when you watch it like a hawk and make sure that goals are added and deleted as needed. in that new environment and during these times of transition, it may be very appropriate that new educational testing is done. You'll also have to be in touch with the school about navigating the physical environment depending on your child's needs. And there's a whole new world of navigating the social environment and the psychosocial pressures that go with that I'll leave to Sarah to discuss a little bit more. When it comes to getting a special education evaluation, schools are expecting a backlog, and they may have to prioritize new referrals versus your child getting a re-evaluation. So it may be easier to get that new evaluation this coming year. And as I stated, when you put the request in writing that you would like your child to be evaluated for special education services, the school districts have up to 60 school days to test your child, develop the evaluation report, and meet with you to discuss the results. A lot of times schools require that adequate instruction effort has been provided before they decide that special education services are needed. So, and just because we're doing virtual instruction or lack of instruction is not reason to push off doing special education services. So if they want to give your child more time, don't do it just because your child's been in distance learning or virtual learning instead. This is another reason where you advocate strong and hard for your child. Next is what testing entails, and the school district is going to focus primarily on what is needed in the school setting. They're going to look at intellectual ability, so they will do a form of IQ testing. They'll test achievement in all expected areas of achievement: reading, math, writing, and then they're going to look at their processing skills and where their strengths and weaknesses are. Another term that you may hear is neuropsychological testing. This is typically not done in the schools. They do psychoeducational testing. Neuropsychological testing is usually done through hospitals or private testing offices, and it really looks at another whole level of learning. Learning's incredible. We have to receive information, we have to process it, we have to integrate it, we have to store it, we have to retrieve it so that we can actually prove that we learned what the teachers wanted us to learn. And education looks at all of those areas, and it also looks at how we output that information through our language and through our motor function. Learning disorders, learning disorders versus learning disability. Learning disorders is really a medical definition. It stresses that we identify a deficit in a specific academic skill. They can also have related motor or language disorders. The school-based term that you will hear is learning disability, and what it focuses on is both the academic skill and what the underlying processing problem is. And this can be done through either neuropsychological or through psychoeducational testing. But again, the schools will offer you psychoeducational testing. Your child's neurologist or developmental specialist, if they have one, may recommend neuropsychological testing to kind of dig a little deeper if it's necessary. The IEP, we've already talked about. This is a written contract. It defines the services to be provided, how long they'll be provided, where, how progress will be measured. There's also something that's called a 504 plan. 504 plans come under Section 504 of the Rehabilitation Act of 1973. And this was the first major legislation that ensured free access to public education. So it guarantees that a child with a disability has access to an appropriate education. So it talks about accommodations, but it does not talk about providing specific services. A 504 plan is great if your child needs breaks, if they need, maybe trips to the nurse, etc. But I really want to stress the importance of getting an IEP if it looks like you really want a binding contract for specifics as to how they're going to meet your child's educational and physical and emotional needs in the school setting. That was all I had. I was going to get ready to turn it over to Sarah, and hopefully we'll have time at the end for questions. So thanks.
No, thank you so much, and thank you again to UMDF for having us tonight. We're going to discuss some ways our children, whether they're at home or in school, how we can really engage them in learning. Okay, so one of the first things that we can look at is how are we presenting the information to our kids? Particularly in times like this, if we're doing whether it's in-home or in-classroom instruction, keeping instruction simple, checking in with students frequently, and making sure that the students are exhibiting a level of comprehension for the material that we're giving them to. Establishing eye contact with children when information is presented, especially when you're going over new material. Providing instructions in writing, and then also using multiple senses, adhering to multiple senses, whether that's verbal instruction, video, hands-on. Remembering that every child has a different learning capability. Now, of course, in the home, there's a lot of responsibility getting put on the parent. So those are also tips for you if you're providing that one-on-one instruction. To improve focus, we want to limit excessive noise, clutter, and visual stimuli. Particularly going back to school, I have already seen photos of what school classes look like now in light of COVID-19. It looks really different, which is going to be really distracting to our students. So that in and of itself is also going to be very noisy to them, noticing that they're 6 to 8 feet away from their friend has a different face mask on, oh, I can't go over and talk to them. There's already going to be a lot of kind of organized chaos going on. So we want to try to limit that as much as possible. Using nonverbal cues, of course, to keep children on task. There's some great tips and tricks on varying websites for teachers to be able to use lights in their classrooms to be able to get people's attention so that there's not a increase of noise of trying to get students to quiet down. Additional time to complete assignments, understanding that what even coursework will look like now being much different, not being able to work with one another. All of this is going to look a lot different and need additional time. Breaking those assignments down into smaller, more feasible chunks. Physical breaks to let children move. I've also been asked a lot about mask breaks for parents. Which again, we're all figuring this out for the very first time. I absolutely understand and can empathize with kids having to keep a mask on all day long is going to be really difficult for them. If a mask break is optional, please make sure that it's done in a very safe manner so that kids are not exposing themselves to any additional germs. And then fidget objects as well. This is going to be, again, a very anxiety-provoking school term, whether they're learning at home or learning in the classroom. So any type of soothing object or fidget object, or even a calming weighted blanket, little things like that can really help to ease some of the students' anxieties. And when it comes to advocating for your child, it's probably one of the largest hats that you wear as a parent. We want to make sure that you're communicating frequently and effectively with the school. I talked to so many of our amazing superhero parents who tell me, I just don't want to call them again, or I don't want them to think I'm a nag. Get all of that out of your head. We absolutely want you to be the squeaky wheel. I love that term because the squeaky wheel gets the oil. We want to make sure that your child is being cared for in the absolute best way. So be honest with yourself and your child's teachers about your child's strengths, weaknesses, and needs. Yes, we are in a pandemic, and yes, we are all trying to figure this out, but the needs of your child do not have to wait either. So expressing that to the school is completely appropriate and within your right. Understanding your educational rights, I love so much what Beth said about really making sure that you explain that you know that they have 60 days to get back to you regarding the IEP. All those little tips and tricks are really good so that you can very confidently go to the school and explain that you know what your rights are. Get an educational advocate or consultant if needed, and I believe we have a slide on there's some really great nonprofit organizations in our area, as I'm sure there are where you're viewing at, where they are not-for-profit agencies that can provide you with an educational advocate. And when possible, involve your child in the planning and decision-making. I strongly encourage kids to attend their own IEP meetings, so even if those meetings are taking place online, it might even be more convenient than ever to have them involved. Okay, next slide. Okay, and remember that you are your child's absolute best advocate. You are the expert, so no one knows your child as well as you do. So how to find an educational advocate? Every state has a protection and advocacy agency for those with disabilities. So in Pennsylvania, we have the Disabilities Right Network of Pennsylvania, which is a phenomenal organization that helps with educational rights. Additionally, there's a few more in this area, including Tri-State Advocacy, which provides free, no-charge educational advocacy. In addition, each state has their own educational law center. So if you were to go to your search engine and just type in your state and the educational law center, every state has a center where you can go, you can file grievances, and you can also speak to live people and explain what your challenges and concerns are. Okay. All right, so we've talked about a lot of stuff, and I know that we want to make sure we save some time for questions, but before we continue, we just want to truly acknowledge the challenges that this pandemic has brought onto the Mito community. I have worked at CHOP for 6 years and I've had the pleasure of working with some amazing mitochondrial families, and I cannot begin to imagine the anxieties that the entire community has been feeling, that we have been feeling around not just going to school, but medical care, and most importantly, the unknown future. So we appreciate you so much just by being here tonight and having this conversation with us. I'm gonna get a little bit more back into the COVID and kind of talk about how we are helping our kids cope with COVID. So the interesting thing is that normally when we talk about life events, it should be a linear trajectory. You know, life event happens, we cope with the life event is over. That's not gonna be the case with COVID, as we've all learned now in August, yes, it's August, in August of 2020. So if we were to start this graphic in the top right-hand corner, teaching children about the COVID-19 virus, I'm going to tell you some tips and tricks and reliable places of information where you can get to have that conversation. A lot of the parents that were reaching out to me back in March and April, it was, how do I explain a virus to my child? And the answer is, it's not super easy, but we're going to give you some tips on how to do that. Then shifting into showing how children can keep themselves safe and why it's so important to keep themselves safe. So talking to kids about washing their hands and social distancing, particularly when you're working with young ones or when you're working with children with intellectual disabilities, is really tough. So we have some tips and tricks on how to make that an engaged conversation. And then lastly, really helping children cope with losses that they've experienced since COVID-19 has started. And I think that that's been the influx of information that I've been getting from the parents and families that I work with. Hey, my kid knows what COVID is. My kid understands how to wash their hands, but they're really upset they've missed summer camp, they've missed sports, that they've missed their friends, they missed their grandparents. And those are all extremely valuable losses that we really have to acknowledge and empathize with them. And again, unfortunately, we're probably going to anticipate that this cycle is likely going to keep turning. So we want to be prepared. We want to make sure that these conversations continue to happen. I'll take the next slide, Beth. Thank you so much. So teaching kids about COVID-19 virus. So first and foremost, absolutely use age-appropriate information. We spoke earlier too about really using information from good scientific sites. The graphic I have there on the right is a cover of it says a kid's book about COVID-19. If you are familiar, a kid's book about is a series of children's books. I am not sponsoring them in any way. However, I do use them often in my work. They have all different types of amazing topics that you can talk about with their kids. I personally read this one back in March. They have a free downloadable copy, an ebook that you can download, and it's very kid-friendly and easy to understand. And you can also purchase a hard copy if you'd like. But that's just one of many different resources. There's a few different books out there that teachers have made in order to help explain this. So just know that there might be something out there and you don't have to do all of this on your own. So we want to try to point you in some good directions. So when questions get directed toward you, answer them honestly, even when you don't know the answer to something, particularly when kids are pretty in tune to when their parents are scrounging together an answer or just trying to tell them, give them some information, and truly sometimes just sitting and they, you know what, I'm not really sure, and I can understand how that might be scary, is an okay response. You guys are all in it together as a family, so being open and honest is really important. Using those reliable sources for those kid-friendly information. I have been consulting my child life specialist here at CHOP, who works really specifically with kids with different developmental needs, on getting information to my families that's really age appropriate. So utilize services that may be available at your local hospital or school, or even your pediatrician for guidance. So showing kids how to keep themselves safe, and really teaching them about the basics. Hand washing, masking, social distancing, touching their face. There's a lot of different tips and tricks. The graphic I included is probably one of my favorites. Putting on a pair of clean gloves and using some colored paint, and showing kids how to wash their hands by really spreading the paint all around. And you can kind of teach them really good hand washing techniques by displaying them, and makes it fun because who doesn't love getting paint all over the place? Sorry, parents. But yeah, so this would be a really great way to be able to really show where you want the soap to go, and how long we have to wash our hands in order to really make sure that that happens. Truly to try to make these activities interactive so that they stick and that the kids get excited about learning them is really important. And to really understand and explain the why. So for example, if we want to really talk about hand washing, explaining, the reason why we want to wash our hands is because we don't want germs getting into our eyes, nose, or mouth, so that they know that that's the why behind it. So knowing the why sometimes will also help them kind of keep them doing those things that we're trying to instill with them now. Okay. So keeping kids at school is a whole new venture for us. So we have a pandemic going on. We're trying to keep kids safe at home. And what do we do to kind of keep them safe at school? So we've got to put a lot of responsibility on the school, as we rightly should, but then also preparing kids the best that we can. So explaining that the same rules that we have and we follow at home don't change at school. And we acknowledge how challenged and tough this is for kids. And I think it's really important that we as providers and as parents really sit with that for a moment, that these kids that are going to be going into classrooms that look a lot different, with kids that look a lot different, to not being able to run up and hug a teacher or run up and hug their best friend they haven't seen, it's going to be really tough. So just knowing that and encouraging an ongoing conversation about that is really going to allow kids to know that they can go to you when something's bothering them. And as for parents, really ask schools about their plans. And it's okay to be specific. Ask about distancing and ask about masking. And express concerns if you feel as though the school is not meeting at minimum what the CDC guidelines are. And really be creative. I think that there's a lot of opportunities where, we certainly need to hold the school to a certain standard. But just like us and them, we are all trying to figure this out as fast as possible. So at the end of the day, we want to do whatever we can to be creative to get children the things that they need. So for example, if a school has a delay in implementing things like therapy, like PT or OT, reach out to your healthcare provider and say, hey, you know what, I'm going to go to my local physical therapist and occupational therapist because I know it's safe, I know it's clean, they're practicing really good safe measures. This is what I'm going to do in the meantime until school can get their PT and OT up and running. Is that convenient for you? Absolutely not. However, we're going to do what we can in the interim so that we can get them services until the school can kind of play catch up. All right, and my amazing child life specialist came up with some tips about wearing masks. I'll go through these super quickly, but modeling good mask use when you're out in public, making sure that you're using the mask appropriately, over your mouth, over your nose. Kids are watching you, they're gonna mimic you and imitate you. Explain the why, explain the importance of wearing masks. If they ask questions, be very specific. So for example, we wear masks to keep ourselves and others safe, but we also wear them to keep grandma and grandpa safe. Be positive about masking. Even very young children can pick up on cues of dislike or anxiety. Go out on small outings that require masking to help them practice, get them used to wearing a mask. This can even be done at home if you don't want to go out of the house. And let them choose the design of the mask. You'd be surprised how much more involved they get when they get to pick out the design or color. The mask that they get to choose makes them much more excited about it. Okay, so virtual, homebound, and homeschooling, I'm going to try to go through this one fairly quickly, are three really different modalities of education. The homeschooling, of course, can be a cyber option. It existed pre-COVID-19 of where parents were providing education to their kids. Homebound instruction is more medically based for children that are too medically complex to enter the school. Also has been around since pre-COVID-19. And this virtual learning is kind of what we're talking about, that this is this new hybrid model that schools are implementing where possible, where kids are going to be doing a lot of this virtual learning. So it's important to ask about what is available in your district. And I'll explain why, because a lot of times I can say this on August 12th, I'm not 100% sure what these three options will look like in your district. And the likelihood is that they may not know either. So it's important to ask what is available, what services are going to be available, because it may be different if a teacher is going to run a Zoom class or if you're going to be responsible to run a Zoom class. So asking specific questions like that will be really important. And will those virtual options work for your family, particularly if it's a therapy option or a speech therapy option? And if it doesn't, again, be creative. Think of things outside the box. And of course, involve us as your medical team or your pediatrician for creative ideas. Okay, so helping, probably the toughest thing, helping kids cope with the losses that COVID-19 has caused. All I can say is communicate, communicate, communicate. Allow that gate for communication to remain open. Utilize those available resources. Sesame Street did a really great Q&A back in the spring, which was really awesome for younger kids. And there are a lot of resources available now. I can even make sure that I get some over to the UMDF so that we can link them so that you can use them. But really just conversation starters so that you're checking in and seeing how your kids are doing. Really listen, acknowledge their questions. And unfortunately, I have the privilege of being on here with, two amazing mitochondrial experts. When you hear some of the smartest individuals say, we don't know what's happening, it can be scary, and it's okay to know that and to understand that. I can't say enough to maintain structure, including socialization. So these are kids that have not been able to see their friends, that haven't been able to see their teachers. So maintaining structure in the best way possible is super important. And that includes socializing too. So even if that's a Zoom date or a play date with somebody that you know has been quarantining and that you trust, make sure that something regular that kids can look forward to will really help with getting kind of their schedule in place. And most importantly, seek professional help when appropriate. Therapists all across the country are all doing virtual. Even play therapists I know in the Philadelphia area have been able to do really amazing things over virtual options. And COVID-19 right now is something that everyone in the world right now is dealing with. And it's okay to need professional help to deal with the anxieties and stressors that it's caused, even for kids. And I think our last slide, have to talk about our amazing caregivers who I worry about so much. Caregiver fatigue and stress, we want to make sure that we absolutely acknowledge that this is such a challenging time. Within a couple months span, we have asked parents to become full-time caregivers, teachers, cooks, everything to just add to the list. But we want to, first of all, acknowledge that there's many factors outside of your control, which I'm sure is really difficult as a parent, particularly when you're raising kids that are medically complex. But knowing that and understanding that would be extremely helpful. how to incorporate self-care into your life and making it feasible and doable. And I have this conversation, I say self-care, and I'm sure that there are eyes rolling, and I understand, but it is so important to incorporate, even if it's a tiny bit of self-care. If it's 5 minutes to yourself outside on the deck, something that is completely feasible and doable that you can make a part of your routine. And routines are extremely important. I encourage families to limit your media exposure. You're your best expert. Know how much COVID information is too much. I usually tell families at least do not start and end your day with COVID information. Try to make sure that you are limiting your intake of whatever news outlet that you are using. And again, professional help if needed. This is an extremely challenging time. Most HMOs right now are not even charging co-pays for mental health services, particularly for virtual sessions. So if it's something that you're interested in, call the number on the back of your card. Many therapists are accepting new patients over the virtual option. So thank you so much for your time. I know that I have gone over, so I deeply apologize.
There is no reason to apologize. I thought that all three of you were so comprehensive in what you showed us this evening, and you answered several questions that came in, but there are still some that need some answers. And I just have to say, I mean, you know, when you're a parent with a medically compromised child, you have all of these issues that you have to deal with, and then to see all of this and add COVID on top of it. I mean, our parents are just incredibly amazing to me to have to go through all of this and plan for all of this. So let me get to some of the questions, and I'm going to combine a few because some of them are very similar. They're asking about, in some areas, the schooling is going to be a hybrid. So you may be in class 2 days a week and then be home 3 days a week. So I'll toss it out there. They wanted to know, should they do the hybrid, or should they just keep the kids at home?
So I'll go first with that one. I think that hybrid is trying to meet the best of both worlds, and certainly it should help with some of the cleanliness issues, the social distancing, right? If you have some kids coming on one day and staying home the next day, the idea is that you have half of the number of kids in the classroom so that social distancing is possible. I think that we all stress, and Sarah particularly, the need for routine. So some kids might not be able to tolerate this. You know, they need to know what their schedule is, and they need to know that every day is going to be pretty much the same. And they may or may not be able to do the hybrid model. Some of the kids are like, oh, today's the home day. Okay. And then the next day is the school day. Great. And they might be able to handle that. But for other kids, it may be too much to do the back and forth. Of course, when they're at school, the concerns are, is the school following the CDC guidelines, and how's the cleaning in between kids, and how are they limiting the touching, and are the kids wearing masks? And then, as we've heard about, what about the days that they're home? Is the virtual learning adequate? Are they still getting their needs met? And this is why I said earlier, we're really between a rock and a hard place. There is no perfect answer. It is not the perfect answer to return to school, and it's not the perfect answer to stay home. So the hybrid model, if it's being offered, might actually be a really good solution for many of our patients. It may not be the right solution for everybody. And Beth and Sarah, I don't know if you want to add to that answer.
No, I completely agree. And again, trust us, if we wish that we had a single answer that was just across the board, perfect for everyone, that does not exist in medicine. It does not exist here. It certainly doesn't exist in COVID, unfortunately. It is such a personal decision to decide what the best decision is as a family. You know, I really encourage you, if possible, involve your student in on the conversation, and really think about what their strengths and weaknesses are. If you have a student that's extremely independent, that has anxiety about COVID, that may be a situation where staying at home might be more appropriate. But really have conversations, get as much information from both the school, from your healthcare providers, and know that the decision that you're making is the right choice for your family. Just know that.
Please don't second guess yourself. That's all I ask.
You know, one of the things we didn't talk about was college age students. A lot of them heading back to the dorms. So we have a question from Canada, And of course, in Canada, they're all adhering to health guidelines. And the question is this safe for the student to go live in a dorm, even though they're sort of sequestering COVID positive students in separate areas?
Yeah, college age raises a particular issue because they're not always then under the parents' watch. And in college, kids are notorious. I'm not worried about them so much in the classroom.
Yeah.
It's the after classroom activities that we worry about. And we just saw, on the news all summer long, the teenagers getting together, having social fun and bonding it's a very age appropriate activity, but this is where they're going to spread the virus among each other. And if I had a child heading back to college and I had them promise that they would never get together with friends outside of class, and they promised me, I'm sure that they would be lying, right? I mean, there's just no way I wouldn't be able to adhere to that. And so it is an issue. There are some colleges that are letting some students do virtual learning. And if that's an option, great. I've had some kids that even though most of the learning will be virtual, they still want to return to the college setting and live independently and take virtual classes and stay in their little tight community. And again, that's their quarantine. That might be a really good option where they stick with their roommates or their, very limited number of friends, less than 10 friends at a time. Now, what's hard, again, is that if one of those people who your child has chosen to be part of their team goes off and exposes themselves by going to an outdoor concert or, is with hundreds of other people, that person can then bring it back to the smaller group and expose them. So I think this involves a really honest conversation with the college student. What can you promise? What can't you promise? And, what are we going to do if and when you get sick? How, are you going to tell me the truth? Are we going to seek help? How is that all going to work? So again, not an easy decision, but, we really do need to balance, people kind of trying to move on and live their lives and get back to normalcy with the risk of contracting the virus and getting really sick.
Dr. Goldstein, I want to stay on that because let's suppose a child, and we had a question, a child is going back to school, but the parent is an affected adult, may have me loss.
Yes.
Should the parent then sequester themselves from the child going back to school?
Yeah, I saw that question. I thought that's one of the questions that really just demonstrates how complex this issue is. Now you have a child presumably asymptomatic, but going back to school, getting all that exposure, coming back to the home, and now we have an adult that may or may not decompensate or have stroke-like episodes with a viral infection, that may have other comorbidities surrounding me loss like diabetes that might pose a higher risk group for getting COVID-19 complications. But then I'm thinking about that adult now socially isolating, not being with the rest of the family and having those ramifications. What if there's other kids in the household that parent still has to take care of, the younger kids? There's layer upon layer of issues. So, how I would answer that question, to really guide that person or anyone in a similar situation is one of the things you could do if you didn't want to socially isolate in a bedroom or a basement apartment is say, we're all going to keep our masks on at home. Mm-hmm. And we're not going to be in the same room together. I'll wave to you from the kitchen to the dining room and we'll do mealtime, but it's going to be 6 feet apart at least and in a well-ventilated room, and the family unit still gets to stay together because I don't know who I would relegate to a basement apartment unless this is somebody who needs a little escape and says, I'll go live in the basement for the next 8 weeks. Thank you very much. But all joking aside, these are really complicated issues. And there is no right answer. I hate saying that. I wish I could help everybody and say, I have the answer. Here's what to do. But I think, it's just, it's a risk-benefit ratio. Every single question, we're weighing the risks and the benefits, the pros and the cons, and it has to come down to what you're comfortable with. I think the honest truth is that, Beth and I were back at the hospital today, and, we're wearing masks, and yes, I'm taking it off to have a drink or talk during a conference because no one can hear me with the mask on, and we're trying to stay 6 feet apart. and we're in the hospital and we're getting exposed to who knows what. And at the end of the day, we have to remember, what was all this for, the stay-home orders and the socially distancing? It wasn't to avoid getting the virus altogether. It was to make sure that thousands of people didn't need an individual hospital at one time. And so part of our conversation has to shift from, can I protect myself from ever getting this virus? I don't know if we can guarantee that for anybody until there's a vaccine, and a safe vaccine, or until COVID just blows over and it's gone, just like some of the other viruses like H1N1 kind of blew through and is over. So, I think that, I'm kind of going off on a tangent, but you really, if you wanted to avoid getting the virus, you probably could if you decided to hole up by yourself and never see another living person. And that may not be realistic for anybody.
Okay, Dr. Heuer, I'm going to come to you next, and I have a couple questions for you, and then Sarah, I'm going to come to you. So in the beginning of your presentation, you were talking about signing up and meetings and trying to get the IEP and the 504s in place. But if I'm a parent, one of my fears is going to be going into that school, and I think you said that this has to be done in person. Nope. Good. Clarify that first.
What you need to do, I like to drop, you sit at home and you just write that letter requesting special education services because my child blah. And then I like to drop it off this is pre-COVID, drop it off personally at the school, because that way it was received. You have someone sign it, date it, give you a copy. You have living proof that it was handed off to somebody. You can do this via mail. You can do this via fax.
Okay.
And, there are other ways to do this in, 2020. So you do not have to do that in person. You can have an IEP meeting as a web call or as a conference call as well. I sometimes like to read a room. So if it were an option to mask and go in and be socially distanced at a table, I would want to do that, because I want to know you. I want to know you who's taking care of my child or telling me that my child can't have something.
Okay, and the other question, and I'm going to read it, can they require adequate instructional effort before a meeting, even if you've already had a neuropsychological testing that includes accommodation recommendations? So this parent says that this is their first year in public school. The children are in 10th and 12th grades, and they don't have an IEP or a 504 in place because they've had accommodations at their private schools.
Sure.
And they're requesting a 504. They have been requesting since early July, verbally. Finally did it in writing this week because they keep delaying and saying they want to see how they can do without accommodations first. Do you have any suggestions on that?
Okay. If you have the neuropsychological evaluation, and the psychologist will always at the end of those write, these were the child's strengths, these are the areas of weakness, these are what could help this child, given their learning profile, succeed. I feel that taking that directly to the school highlighted and saying, this is what I want in my child's 504 plan, not can I have one, we need one, and these are the recommendations from his neuropsychologist.
Okay. Sarah, finally I'm going to ask you, because I know we're way over time, but you presented so many valuable pieces of information, but outside of school, give me your best advice to help these kids stay connected, because it seems like, we can't have the play dates, we can't do this, we can't go to the park. Well, we can go to the park, but what is your best advice to help these kids have some semblance of normal?
That's an absolute great question. So these devices that we're always pulling out of their hands now, so some of it includes technology, that there is definitely a component here where we are very technology driven. And thank goodness, because if this was happening back when we all didn't have cell phones or Zoom or screen chats, it would be a lot more lonely. So I think it's completely appropriate to have organized, structured time, particularly for kids to either FaceTime or to have like a group Zoom call. A lot of gaming portals also allow you to kind of interface over the internet as well if kids are into gaming. Of course, everything in moderation. For some of our younger kids, Myself and our child life specialists have even been telling parents like to go back to the art of letter writing, you know, to going back to becoming pen pals and doing more creative things like that. The parents that have engaged in that type of activity say that the kids get really excited going to the mailbox and looking to see if they have a new piece of mail. But really just engaging in activities, and even activities that you can do virtually. There's even some board games that families may be able to play virtually in one house and kind of have it on an iPad virtually at another house. There's all different types of different ways I think that we can use technology, but that there's also more crafty ideas too that you can use. But really maintaining that connection. So maybe it's a scheduled Zoom call, or maybe it's something a little bit more creative.
Okay, thank you all so very much for an excellent presentation. I'd also like to thank my colleagues, Kara Strittmatter and Margaret Moore, for producing behind the scenes and making this all possible and collating all the questions for us. But thank you for giving us your time tonight. We truly appreciate it. We will have this up on our YouTube channel. And I would also remind you to watch social media, our social media channels, and your e-blasts, because we will have another Ask the Mito Doc webcast in September. Thank you all, and have a pleasant night.
Thank you so much.
Good night, everyone.